Hello. Welcome to another edition of Colorectal Cancer Canada's Tush Talks. Colorectal Cancer Canada is the nation's leading colorectal cancer patient group, and Tush Talks are our webinar interview series where we provide information from experts on topics related to colorectal cancer patients, survivors, caregivers, and their families. Our talk today is on Scanxiety, or the anxiety you can feel around scans relating to colorectal cancer. And our guest is Connie Pickett. Connie Pickett is a registered counselor and certified life coach who specializes in anxiety, grief, and trauma. She's a mom of three, a wellness advocate, and a two-time cancer survivor herself. Taking a holistic approach to wellness, she uses evidence-based strategies with real-life personal and professional experience to help people have a healthier relationship with stress and anxiety. Connie, we're so happy to have you. How are you doing today?
Thanks, Carl. I'm well, thanks.
It's good to hear. Um, shall we just jump in with sort of the initial thing that is on my mind, which is what is Scanxiety?
Oh, yes. Well, you've touched on it at the very beginning when you said, that anxiousness that comes with getting a medical scan or any kind of test. So it's really that tension and the worry that, it could also happen during, before, after, while you're waiting for your results. You can feel extremely anxious, and sometimes it can be quite debilitating for people.
Hmm. And you said it's debilitating. How does that manifest? What does it feel like to people when they report feeling this feeling?
Well, it's different for everyone, but there are some commonalities. For instance, in your chest, might feel it's really tight. So there's physical manifestations that happen. You can get increased heart rate, some palpitations, some people get sweaty, shortness of breath. You can even get nausea, right? An upset stomach, fatigue, um, some weakness, and definitely insomnia. Insomnia or difficult sleeping is a big one as well. There's also emotional symptoms to it. So you might be feeling, not only feeling nervous, but you're now tense or on edge or noticing that you're getting quite irritable. Restlessness is right there as well. And a lot of people find it's really difficult to concentrate or focus.
Do you find that scan anxiety or scan anxiety is different in some ways than the sort of everyday anxiety people might experience?
Different than the everyday. Well, here is a big difference. For one, is anxiety in itself has all those physical symptoms, but when you relate it to a scan is technically a short-term result, right? So after you get the scan or after you get your results, the idea is that anxiety should dissipate. May not go completely, especially if you're going through cancer treatments, but it should definitely lessen. So is it different? Well, it depends what the root cause of your anxiety is, for one, and a lot of the times that's uncertainty. So if we relate it directly to, in this case, scanxiety, then once the scan's done, hopefully your anxiety will subside.
Mhm. So what I'm kind of hearing is that scanning is obviously a source of anxiety, and
Mhm.
often people are anxious about the unknown, like you said. So do you feel like it's normal that people would have scanxiety, or like if you should see a doctor if you're worried about it? Like how should we feel about this phenomenon?
Well, first of all, let's give ourselves some compassion. Absolutely. It's normal and it makes sense that we'd feel that way because we don't know the result, right? So we are anticipating something that we have no control over right now. So it is normal. When you had said, at what point do you feel like you should potentially see a doctor or talk to your doctor? You know, I would suggest in that case is any time that we feel like our health is at risk, always see a doctor, right? Because they're on your time, they're on your side, they're your team. That memory in itself of uncertainty, it can cause a lot of concern and it can impact your well-being. But when it comes to your daily functioning, your quality of life, it's, impacting your blood pressure and your heart, especially if you've gone through treatments and you may not already be at a level where you're feeling certain that your body can handle the extra anxiety or the pressure. Definitely talk to your doctor.
Right. That's sound advice, I think. um, on the level of like this anxiety being a natural response, how often do you encounter people expressing specific anxiety around things like scans?
It's extremely common. In fact, I think there was a stat I read recently that was like um, more than half the people who go for scans in general, not just related to cancer, feel anxiety. So it's extremely normal.
Yeah, I
So,
know I'm certainly one of those people who, if I'm going to the doctor for any reason, I'm like, oh, this could be a big problem. I don't know. And I know I feel anxious about that. And I can imagine it being much more acute on something as high stakes as a scan relating to a cancer diagnosis or cancer treatment.
yeah, exactly. And I think what happens for a lot of people is that, we're going off of how the brain works. It's meant to protect us. That's its role. That's its only job. And so, when it comes around anxiety, so obviously we've had, you know, if you're looking at someone who's already had their diagnosis, for instance, you're going back on the potential of that memory of the negative result that you first got. So you're immediately going to feel overwhelmed, right? Your body is alerting you with that extra cortisol saying, okay, we got to be on guard in case this next scan, brings something that we feel like we may not be able to handle. But in reality, okay, if we can just check in for a moment, we don't know what the future holds. We cannot predict it. So it's up to us to notice the job of our brain is to protect us, and it's a great protector. But we also have to rely on our knowledge going, in this moment right now, I don't know the future. I cannot predict it. So all I have is right now. And right now is the present moment. So hopefully that allows you to refocus so that your brain doesn't have to keep going off like a fire alarm, right? It doesn't have to keep thinking it's trying to protect you from something from the future, that you actually already are safe in the right now and in the present. Does that make
Yeah,
sense?
it does. And it strikes me that talking about how to find that centering, how to find that living in the moment, what are some ways or some tools to do that, to cope with the anxiety?
Oh, I have so many that I love. But the first one I would say is self-compassion, right? Absolutely. Notice and accept the way you're feeling, because we don't want to try and push it away or pretend it's not happening or get frustrated with ourselves that I feel so stressed. We want to just relax into it and go, hey, yeah, it makes sense. Okay, so now what can I do? And a big one for me is mindfulness. It's always coming back to the present moment. It's the moment that my brain starts to go to overthinking, try to equate that with problem solving, as we kind of just met. So it's little things like, a good one that I've done before is, if you can talk about what you are doing, is a great little tip. So for instance, right now I'm grabbing my coffee. I'm about to take a sip of my coffee. My coffee tastes like this. And so if I'm actually talking out loud, I don't have time for additional thoughts to overthink. You can do that while you're making breakfast. You can do that while you're putting on your clothes. It brings you back into the present moment. It keeps you focused and mindful of what you're doing. So mindfulness is really being very aware of what you're doing in the present moment. Right? So
Right.
the overthinking wants to take us out all the time. Being able to say out loud what you're doing can help you bring you back in. So that's one trick that I really find helpful when I just can't stop those thoughts, right? Um,
Can
Another
I
one,
ask you a question actually before you move on to your next one? And I do want to hear it. I'm curious to hear more about what self-compassion means to you in this context. Because what strikes me, I think that's the fourth time I've said it strikes me, but things keep striking me. That it's not unusual or a problem to feel anxious about something so important. And I feel like that might connect to this feeling of self-compassion, of allowing the feeling to be what it is and not trying to squish it or whatever. Is that close to how you feel about it? What's your take on this idea of self-compassion?
yeah, absolutely. I think let's normalize how you're feeling first, right? So that we're not trying to feel alone in it. It's giving yourself permission, as if you were going to soothe a young child, for instance, in how they're feeling. We would say to them, oh, yeah, it makes sense that you're angry. I get it, and I'm with you. I'm not trying to fix the problem, but I'm trying to be with the emotions, right? The feelings. And that's exactly what self-compassion is.
Yeah. And so these tools that you're saying about coping, it's not so much like how to get rid of the feeling or remove the feeling. It's how to use how to not allow the feeling to like control you. Is that sort of how you would describe that?
Yeah, the way I look at it is it gives us a new relationship with the feeling. So, for instance, we're all going to have stress in our lives. No matter if it's a scan, it doesn't really matter. We've still, while you're going through treatments, you could still be dealing with work, with family, a variety of things, right? Financial. So we're always going to have the stress. However, it's how we hold the stress that's going to make a huge difference. It's going to help our environment, which is our internal body, right? Flourish versus trying to always fight what's happening. So there's a level of acceptance, and there's the slowing down and not dissociating, meaning if we're always living in our head, we're creating this overthinking, busy mind, and our thoughts create how we feel. So while when we go through cancer treatments, I do believe that it's probably very necessary for us, and I know it was for me, to be on what we call survival mode for a certain um, part of it, for sure. And it's hard to not be, right? You're always kind of getting ready for the next phase or the next bit of news, if that's the case, because that's the situation we're living in. However, can we give ourselves breaks in between? We can't just stay on that high alert, that survival mode all the time. Our body wasn't built for it, right? And a scan is very similar to that, meaning, yes, we're going to be on high alert with the scan for now. Even before the scan, it's like when I see the date coming, sometimes it's like, oh, there's that cortisol. It's preparing me for the future of something that I don't know about. So I'm up here on my levels for cortisol, right? The stress hormone. So what I want to do is be aware that it's there. And how can I give it a break? How can I not allow myself to be impacted by that? Because we know that chronic stress, that chronic shooting of cortisol through our body can wreak havoc in the long term for us. And we actually, we want to be aware of that. I don't want to stress anybody else about, oh, we have cortisol, we got to get rid of it. It actually is very necessary. We need it to wake ourselves up in the morning. We need it to give us the motivation to get out and exercise. It's not a bad thing. And, that's another way to look at your anxiety. It's not bad. It's there for reasons. It's just, how can we look at it differently? How can we have a different relationship with it so it doesn't impact our internal lives so much and become an unnecessary, what can I word that as? I don't want to say it evil, but let's have it do us more positive than negative.
More cumbersome than necessary.
Thank you. Yes. Yes,
Yeah.
definitely.
Well, on that then, I did kind of interrupt you while you were saying some potential strategies to mitigate or to navigate those feelings. Would you like to share others?
Yeah. So one that I find is really helpful is breathing. And I know it sounds crazy. We all breathe. We all do it. But when we are in what our survival mode or that freeze or the fight or flight mode, we can tend to forget that we're not breathing from our belly. Our survival goes right to our chest. We're we're built that way. It's to conserve energy. So we actually have to force ourselves through a check-in to just make sure we're breathing with our belly. So the idea is, as you take, I love this, it's called 5-2-7. So the idea is we want to take 5 deep breaths in through our belly breaths, which is when we breathe in, our belly should go out like a balloon. Okay. We're going to hold for 2 seconds and sniff really hard in twice. That's going to help stimulate that parasympathetic faster, okay, response. And then what we're going to do is we're going to let it out really slow for the count of 7. Do you want to try it with me?
I'd love to.
Okay, so let's try this. So we're going to take a big deep breath in for the count of 5, 4, 5, hold, and you're going to take in 2 deep, really quick breaths. Hold for 2, and now you're going to slowly exhale for the count of 7. Your belly goes in. Great, like a deflated balloon. And you should actually tap into that feeling of the air escaping you. So we're not just doing it with our body, but we're actually tapping into a part of our mind that allows us to start feeling what it's like to have that air go through you. So it's a mind-body approach that we need to take when we start looking at feeling better. Right? So that's one way. Another way that you can even deepen that experience is if you had any essential oils at home, like lavender. I have one here, but you can rub it on your hands, okay? And as you're doing that first deep breath in, you're actually cupping it with your nose.
Hmm.
And you're getting that essential oil smell, something like lavender or eucalyptus, and that will help deepen the experience just a little bit more.
Like the sensory element kind of enables greater awareness of the feeling, kind of.
Absolutely. You said that so well.
Oh, thanks.
Yes, it does. Aromatherapy has been known to help calm the nervous system, right? So why not engage as much of those tactics as we can with our breath? You can also do it to what's called binaural beats.
Hmm.
And have you heard of that before?
I it's like music that has a couple of different like rhythms going on, and you can kind of listen to one and focus on that and listen to another and focus on that and
Yeah,
sort of.
so binaural, absolutely. Sorry, Carl. But what it does, it is actually binaural beats or bilateral stimulation. You can get one that has both. It allows your left hemisphere and your right hemisphere to start to work together. Because when we're in fight or flight, we're actually disjointed from those. We're not fully in our thinking brain. We're on that heightened alert. We have all that cortisol coming through us. So what it does, it helps to calm both by going back and forth. So it's nice to also do that with your breath work. It's slowing down, giving yourself the opportunity to just take a moment, right, throughout your day. And you can do it often.
And on the level of like these all seem like wonderful tools in the moment if you notice these things happening. Are
Mhm.
there other ways to sort of get ahead of it, if you will, like before your scan, if you know you're liable to feel a lot of anxiety? Are there, I don't know, preventative tools that you have to offer?
I do. And the preventative ones are extremely useful. I actually believe in making rituals. So a morning ritual, I work with people and tell them to, if they're not one used to checking in all the time with themselves, actually make a practice of it, right? Every hour or every time you're going to take a drink of water, just slow down and start engaging your senses. You take that sip, you breathe, you hear what's happening around you. Maybe there's a bird, maybe there's a child outside that you can hear them laugh, and just ground yourself. Feel your feet on the floor, or your pillow in your chair. Engage your senses throughout your day. So that's one part of it. But your morning rituals are extremely important. Things like having that glass of water before you have your coffee. Sky before screens helps anxiety. When we quickly go to our phones, we're actually engaging a part of our brain that says, okay, now I got to get ready for the day, quick, quick, quick. Whereas if we can just see nature, right? Put our face to the sky through our window if we can't get outside on a rainy day, that hasn't engaged that part of our brain that tells us to be, on fire, ready to go. So we get that moment to kind of ease into it, set our day up. So rituals are really important. And I would suggest doing a morning and an evening one. And a great one for either is doing a quick body scan. So muscle relaxation, get you started for your day and help you end your day. So basically, what happens is you get a chance to just, as you're laying there in bed, even take your deep breaths and start with really noticing, move your toes around, squeeze them under really, really hard and let them out and feel the release. And you can do that all the way up from your toes to the top of your head, right? Just squeezing each body part, not so hard that it's hurting you, but definitely where you're feeling that release of energy. And that flow allows you to go, start my day. I can check in where I'm tense from the night. Maybe I'm grinding my teeth. So giving my mouth that chance to have that extra feeling of relaxation can be extremely helpful.
And it also seems to me that by building those practices, you're kind of training yourself to become aware of when you're feeling anxious, so that if you're feeling anxious, you're able to be, oh, and I have the tools, instead of, oh God, I'm paralyzed, I don't know how to handle it.
Absolutely. These things are a way of life, truly. I no longer feel anxious with my scans. I just had my last one, and I know the hardest part usually is the wait after. Sometimes it can take 2 to 3 weeks, depending on how busy the medical system is, if you get your results. And sometimes that drives people through the roof with their anxiety. So, because I have continued these practices, you know, yes, did I feel a little nervous? For sure, right? I'm not saying it wasn't there, but it wasn't there all day. It's like I was able to notice it, go, okay, yeah, I need some time for a second to check in. And then it went about part of my day and I felt good. It is a ritual that we do on a daily basis to help us create resilience for uncertainty, for one. And, another thing that I'd like to remember too, Carl, is it's important to, lost my train of thought, but it's one of those things that by practicing this ongoing, having the tools, you can use it in any part of your life, right? Not just with this scan. But there are a few things that I kind of want to point out that the day of the scan can also help you to calm your nervous system. Things like taking a special item with you. If you have a photo of a loved one that, maybe they couldn't be there with you, but you can just bring it and just feel the gratefulness, the gratitude. It's not physiological possible to feel anxiety and gratefulness at the same time.
Mm.
So it's not just thinking, I'm so grateful that, I have family and I have a roof over my head, but needing to feel it. Where do you feel that? Does your heart feel just a little bit lighter? And the love you have for the people around you and for what's happening in this moment. So they can't coexist, which is quite nice. So using those little tricks, taking something with you that brings you that comfort, that love, that gratefulness. Another thing is I have a positive mantra that resonates with me. So often when times get hard, I say to myself, I've been through hard things before, and I know I'm going to get through no matter what comes my way next. So that's mine, right? That grounds me, that brings me back to confidence, and also being aware of my posture in that moment too, right? How am I holding it, my body? We tend to kind of want to sink in, and we hunch over with anxiety, and we can feel trapped. So as you do your mantra, find a way to just open yourself up a bit and go, actually, I got this. I know that no how hard, you know, things have been. Wow, I've tackled them before and I can tackle them again. So bringing some of those small tools can also help, especially for the day of.
That's wonderful. Thank you. Thank you for sharing those and how it relates to your experience. I think people will be pleased to hear that. As we're kind of coming to the end of our discussion here, I kind of want to just throw the floor to you for a second to say, is there anything that you would have wanted to mention or wanted to be asked that you didn't get the chance to speak on?
I think one of the main things is knowing that you're not alone, that there's a lot of great resources out there and people to talk to. And we do need to open up and share these feelings so we don't hold them all in. I have put together a sheet of my favorite 10 kind of tips, I guess you can say, on what's worked for me and some of my clients to help kind of combat this Scanxiety that we all face. So that's available.
Yes, that'll
People can
be in the
access
link
that.
below the video for anybody.
Great.
Yes. Um,
Thank-
Yeah, well, thank you. Thank you so much. I will also say that you are one of those people that if people want to seek assistance, you're a registered counselor. So if people do want to reach out, how can they find you?
I think the best way is through my website. It's conniepickett.com. And they can always, send me a note, let me know what's happening for them. And if, there's any resource I can send them to, I will, or I can help them myself if we're a good fit.
Wonderful. Well, thank you so much for joining us and for speaking on this topic that a lot of people have asked about. I have been Carl Bindman with Colorectal Cancer Canada for today's Tush Talk. This has been Connie Pickett. Thank you so much, Connie, for joining us.
Thanks,
And
Carl. I appreciate it.
yeah, you're so welcome. Thank you. And to anybody listening, if they would like, they can reach out to Connie on her website and they can look at the resources that she's made available for us in the link in the description. And also, if you have further questions about colorectal cancer, treatment, care, survivorship, nutrition, tons of resources, anything you could ask, we have what you're looking for at colorectalcancercanada.com. And if you have any specific questions, you can reach out at support@colorectalcancercanada.com or find us on the various social medias. Thank you again, Connie. This has been wonderful.
Yeah.
And have a great day.
Thanks, Carl.